first quarter of 2021, Abu Dhabi has ranked the number 1 as the safest city by the Deep Knowledge London. Leadership during crisis is crucial as it sets a strategic and operational framework to actively increase organizational resilience. The impact of COVID-19 pandemic had hit all aspects of the way we live and how business operates.
Following the breaking pandemic news, the United States just topped 9 million confirmed coronavirus cases.
The average daily death toll from this disease, already rising, might triple.
Germany, Spain, Italy, all living under tighter restrictions this morning.
Yet the ambulatory healthcare services had taken on the challenge and turned this distressed situation into an opportunity to reshape and innovate the systems and processes with the goal of meeting patients and community expectations during this pandemic. AHS is committed to be the gateway to healthcare services in Abu Dhabi and will continue to be. The global pandemic had triggered the organization to think outside the box and use the situation as an opportunity to innovate, do things differently, to cope the new normal, but yet protecting the core business of the healthcare, which is to provide a holistic care. The AHS has established a clear governance to oversight the planning, execution, implementation, and monitoring of the business resumption. The main goal was to serve the community without compromising safety for all. Thereby, the introduction of facility zoning or cohorting strategy in all AHS centers was implemented. The dynamics of patients and visitors flow in an ambulatory care setting during this pandemic was the biggest challenge over and above the complexity of service demand from the community, expectations from local and internal regulations, and the safety of employees at all levels. Opening 30 centers required extensive brainstorming and assessment. Rerunning the risk assessment across AHS centers provided the team with valuable information in the development of business resumption guidelines as a framework to standardize the practice across AHS network of centers. The main driver to the guideline was the customized cohorting strategy, which means grouping of people and services based on the risk of infection. The customized cohorting strategy was a result of a thorough multidisciplinary discussion, study, and analysis of the available data and resources. It was piloted in centers of different scope to capture all possible bottlenecks and system flows. The lessons learned were utilized to enhance the strategy prior to rolling out and was deployed to 30+ centers. Multidisciplinary team representing core functions during the pandemic and beyond were involved. Clear objectives were defined and timeline of implementation was set. At the onset of the pandemic in Q1, the AHS leadership had proactively commissioned review of the business continuity plan and the rerun of risk assessment taking into consideration the WHO and the CDC alerts and recommendations. Services provided in the AHS centers were minimized and high-risk services halted pending the appropriate approved safety protocols. However, as the leading healthcare provider in Abu Dhabi, there is a demand that we need to continue to serve our community, especially the vulnerable high-risk group. This triggered the AHS management to implement the business resumption guidelines around the concept of customized cohorting strategy with a given timeline. Education and awareness sessions conducted to empower the staff to do the right and safe practices at all the time was done. The quality division created monitoring checklists and dashboards as management tools utilized to ensure the safety protocols are adhered to and to capture any process improvement needs. The AHS implemented incremental process innovation referencing to CDC and WHO recommendations with regards to patients and visitor segregation. Majority of the published articles regarding patient segregation were hospital-based. This triggered the AHS to develop a process customized to ambulatory care and the population we serve. The AHS conceptualized and pioneered facility zoning idea based on the London subway and was the first implemented in the AHS COVID-19 prime centers. This process innovation resulted in minimizing the cross-infection inside the AHS facilities and maximized the use of resources such as the PPEs and dedicated staff for each and every zone. Benchmarking, collaboration, and best practice sharing locally and internationally was considered along the way and was necessary to ensure that the AHS keeps track with the current trends and practices in the management of COVID-19. The implementation of the cohorting strategy across all AHS network provided notable results as we adopt and reshape the new normal. Leadership utilized data-driven decision-making while moving forward to fighting the pandemic and increasing the AHS Center's capacity to provide the necessary services and regaining the trust of the community by providing safe service and environment. This achievement was clearly reflected at the level of the staff through the improvement in the staff compliance to hand hygiene and infection control protocols, and at the level of the patients, where the increase in the patient volume and the number of new patient registration, which signifies the patient trust of coming to the clinic despite of COVID-19. The success of the cohorting strategy in the AHS centers paved the way for the AHS to provide external collaboration with private and governmental sectors in their business resumption exercises. Locally within the UAE, the AHS was considered the subject matter expert, where we were approached by several Abu Dhabi governmental sectors to assist them in their business resumption. AHS will continue to ensure the sustainability and reassurance of safety net in implementing the new normal by applying change through plan, prepare, manage, and adapt strategy as long as COVID exists. The collaboration and partnership with strategic stakeholders will continue to safeguard and maintain the public health, safety protection, and reassure the economic stability across the country. Ensuring the delivery of healthcare services appropriately by maintaining the national resilience through healthcare interconnectedness to both public and private sectors, and facilitating the wider and appropriate telehealth use and adopting the emergent best practice. And for sure, the continuous support, appreciation, and recognition of the frontline heroes and employees' contributions and input at all levels as they are behind each and every success achieved in fighting this pandemic.